Bis- Bismillahirrahmanirrahim. Assalamu alaikum. I had to stop recording due to some problem in my internet. So I'll continue. I was explaining you about the structure of insulin and the chains of the insulin chain A and chain B of the insulin, and what will happen if we'll change the conformation, or we change the we try to change the different amino acids which are attached. So usse kya hoga, that we were discussing. Now we'll discuss the therapeutic application of insulin. And as we have, we already know about insulin, as we have, you have, covered insulin in under physiology and under pharmacology as well. So we'll go with the main points of the therapeutic application of insulin. Insulin is used to treat a number of diseases, including diabetes and its acute complications such as diabetes ketoacidosis and hypersmolar hyperglycemia. Hyperglycemic states. It is also used along with glucose to treat high blood potassium level. Now, next is glucagon. What is glucagon? Glucagon is a 29 amino acid hormone used as a diagnostic aid in radiological exams to temporarily inhibit the movement of the gastrointestinal tract and to treat severe hypoglycemia. As a drug, glucagon is a 29 amino acids, and it is present naturally as well in the body. Glucagon raises blood sugar through activation of hepatic glucagon receptors, stimulating glucogenolysis and the release of glucose. This is the structure of glucagon, in which you can see that there is a series of amino acids, but it has two ends in which there is a carboxylic group and an amino group is present at the end. So the chemistry, glucagon is a straight chain polypeptide hormone consisting of 29 amino acid residues and with a molar weight of 3,485 delta. Thus, glucagon is chemically similar to secretin and CCK. CCK is basically cholecystokinin, which the secretin and cholecystokinin, they also both, they get secreted in the GIT, and they aid in digestion as well, along with glucagon. In addition to the peptide glucagon, proglucagon is also contains the two glucagon-like peptides, GLP-1 and GLP-2. GLP-1 is the gut peptide 1 and the gut peptide 2. These also, ये जो सब सारे है ना, secretin, CCK or GLP-1, GLP-2, glucagon, these all are basically जो gut के अंदर nutrition को या dietary फाइबर्स को या डाइटरी फाइबर्स को तो खैर नहीं करते, लेकिन डाइटरी न्यूट्रिएंट्स को जो भी मेटाबोलाइज करना, डाइजेस्ट करना, these all are required in gut. So they have kind of similar structure. So yeah, similar structure and kind of similar application or similar chemistry, similar effects, similar function as well. Okay, biological activity की तरफ हम आएंगे. The main activity of glucagon involves the primary regulation of glucose production in liver in situation of fasting, exercise, and hypoglycemia. Indicates that the main glucagon activity was associated with glycemic control in fasting and postprandial situation. The main purpose is the main purpose or the main time when it is secreted is the time when a person is fasting. Then it is secreted, while So the main purpose which arised about glucagon is that it is secreted, or it has main function during, or it can controls your glucose during fasting. Therefore, glucagon utilization is important since this hormone shows a fundamental role in glycemic control and consequently the maintenance of hemostasis. And for structural activity relationship, you need to get back to the slide again where I've shown you the structure. You can see the structure on your phone as well. The first step in structure function studies to examine the bioactivity of fragments analog to find biological active compounds smaller than the native hormone. Basically, जब हम जिस वक्त भी हम स्ट्रक्चरल एक्टिविटी रिलेशनशिप की बात करें, स्पेशली इन दिस टाइप ऑफ कंपाउंड्स जिसमें पॉलीपेप्टाइड चेन है, दीज आर लॉन्गर चेन्स, ठीक है, ऐसे में आप इसको किस तरह से असेस करते हैं कि आप उसके फ्रेगमेंट्स करते हैं, उसको छोटे छोटे फ्रेगमेंट्स को देखते हैं कि इसका क्या रोल है, इसका क्या रोल है, ठीक है, उससे आपको आइडिया होता है कि कौन सा पार्ट इज इम्पोर्टेंट या उसका क्या उस फ्रेगमेंट का, पर्टिकुलर फ्रेगमेंट का एक्टिविटी पे क्या असर है, ठीक है। तो इस तरह इसकी भी किया गया। स्मॉल फ्रेगमेंट्स ऑफ ग्लूकागॉन इन द सी टर्मिनल रीजन सच एज ग्लूकागॉन 20 to 29 ग्लूकागॉन या 22 to 29 glucagon, and glucagon 16 to 24, glucagon 19 to 29, and many others were shown to be biologically inactive and had no binding activity. These all show that they have no activity of their own. It has been shown that the N-terminal region is critical to the biological activity. The carboxylic acid side hai, that is not important for the biological activity, while the N-terminal region is important, and the C-terminal region is necessary for receptor recognition. The C-terminal is equally important, but for the receptor recognition, not for the biological activity. Several glucagon fragments in the N-terminal region were prepared, such as glucagon 1,6, glucagon 1,12, glucagon 1,15, glucagon 1,17, and many others were found to have no biological activity or receptor binding affinity even at millimolar concentration. So both the sites are equally important. Okay, therapeutic application. Glucagon is an important therapeutic agent in critical care medicine. Although its endogenous hormonal functions have been well described, its clinical use are rarely discussed. Glucagon is effective in the treatment of hypoglycemia, cardiogenic shock, and heart failure. Propranolol overdose, esophageal meat impact, uterine colic due to calculi, and acute diverticulitis. It may prove useful in the treatment of endotoxin and hypovolemic shock, as well as toxicity due to excess of procainamide, guanidine, and ouabain. Oxytocin. Oxytocin is a cyclo-nonapeptide, basically, sorry, इसमें A missing है. Oxytocin is a cyclic nonapeptide hormone with amino acid sequence. इसका जो amino acid sequence है वो है CYIQNCPLG. ये मैं भी आपको आगे describe करूँगी कि ये कौन-कौन से amino acids हैं that also act as neurotransmitter in the brain. The principal uterine contraction and milk ejection hormone. This is we know it as the principal uterine contraction and milk ejecting hormone of the posterior pituitary. Together with the neuropeptide vasopressin, it is believed to influence social cognitive behavior. Basically, जो है ये है तो posterior pituitary hormone ही, but it has effect on behavior as well. Chemistry, oxytocin is a peptide of 9 amino acids. That's why it is called a nanopeptide. The sequence is cysteine. मैंने अभी आपको CYIQPLG में क्या है? Cysteine, tyrosine, isoleucine, glutamine, asparagine, cysteine, proline, leucine, and glycine. The cysteine residue from a form a sulfur bridge. Oxytocin has a molecular mass of 1007 daltons. One international unit of oxytocin is the equivalent about 2 microgram of pure peptide. ये अगर आप देखो तो this is the structure of oxytocin where different amino acids are attached. ठीक है, there are different amino acids. But इसमें ये जो linkage है ना, ये जो through the sulfide disulfide bond, this is important for the activity. कैसे वो भी मैं आपको आगे describe करती हूँ, ठीक है? Biological activity. Oxytocin is a peptide hormone and neuropeptide. It is normally produced in the hypothalamus and released by the posterior pituitary. It plays a role in social bonding, reproduction, childbirth, and the period after birth. Of course, it is required because of for feeding. Okay. For the structure activity relationship, 20-member ring of neurohypophyseal hormone. This is also known as, you can जो pituitary gland है, जो posterior pituitary gland है, वो neurohypophyseal hypophysis भी कहते हैं उसे, neurohypophysis, तो इसको neurohypophyseal hormone भी कहते हैं. A 20-member ring of the neurohypophyseal hormone is essential for bioactivity. Enlargement or loss of activity, non-cyclic structure are inactive. Those which are non-cyclic, they are inactive. Analog in which the sulfur atoms for the disulfide bridge are replaced by CH2 exhibit high activity. मैंने अभी आपको sulfur group दिखाए थे, अगर उसको आप CH2 से replace कर दें तो activity increase हो जाती है. The hydroxyl group of the tyrosine side chain folded over the 20-member ring of the oxytocin acting cooperatively with the asparagine carbamide group is considered to be the active element. Means कौन सा, जो कि जो हाइड्रोक्सिल ग्रुप है टायरोसिन के साथ, इसमें टायरोसिन के साथ जो हाइड्रोक्सिल ग्रुप है, टायरोसिन इधर होगा ऊपर, ये दिस इज टायरोसिन, ये टायरोसिन के साथ जो हाइड्रोक्सिल ग्रुप है, दिस वो क्या कह रहा है कि द हाइड्रोक्सिल ग्रुप द टायरोसिन साइड चेन फोल्ड, क्योंकि ये फोल्डेड है ना, क्योंकि नॉन साइक्लिक अगर नहीं होगा तो इनएक्टिव होगा, तो दिस इज अ फोल्डिंग काइंड ऑफ जो है ना स्ट्रक्चर है, तो वो जो है act करता है cooperatively with the asparagine carbamide group is considered to be the active element. These जो asparagine है, asparagine का कार्बोऑक्सामाइड ग्रुप और हाइड्रोक्सिल ग्रुप टायरोसिन का, ये जो है कंसिडर किए जाते हैं दी एक्टिव एलिमेंट. इंट्रोडक्शन ऑफ 4L-threonine and 7-glycine increases the oxytocin activity to several thousand folds. If you add जो है एक डेरिवेटिव अगर आप बनाएं और उसमें ऐड करें आप थ्रियोनीन और 7-glycine, तो वो एक्टिविटी को इंक्रीज करेगा. The therapeutic application oxytocin का क्या है? In therapeutic application, oxytocin, as we all know, is a potent uterine stimulant that is used for the induction and augmentation of labor, and antenatal fetal assessment and control of postpartum hemorrhage. If used properly, oxytocin can lead to such complications as uterine hypercontractility with fetal distress, uterine rupture, maternal hypotension, water intoxication, and iatrogenic prematurity. अगर improperly use किया जाए तो you can even जो है वो uterine hypocontractility with fetal distress है उसके along जो है वो हो सकती है. और these complications can almost always be avoided if oxytocin is given in proper dosage and with careful fetal and maternal monitoring. Recent interest in active management of labor policies has resulted in the re-examination of the use of oxytocin in augmentation of labor of nulliparous women. Okay, now next is vasopressin. Vasopressin is also called antidiuretic hormone that plays a key role in maintaining osmolality, the concentration of dissolved particles such as salts and glucose in the serum, and therefore in maintaining the volume of water in the extracellular fluid, the fluid space which surrounds the cell. The vasopressin are peptide consisting of 9 amino acids. There are also nanopeptides. The amino acid sequence of arginine vasopressin is cysteine, tyrosine, and phenylalanine, glutamine, and asparginine, और फिर है ये cysteine, फिर है ये proline, and arginine and glycine. With the cysteine residue forming a sulfur bridge. जो cysteine residue है उसके साथ जो है वो एक sulfur bond bridge है, ठीक है? This is the structure. ये भी जो है वो circular या आप कहें folded structure होता है ये भी, ठीक है? Biological activity, vasopressin is also called antidiuretic hormone. इसको एंटीडायरेटिक हार्मोन भी कहते हैं. तो अभी मैंने आपको डिस्क्राइब किया कि वो क्यों कहते हैं. Okay, the key hormone plays a key role in maintaining osmolality, the concentration of dissolved particles such as salt and glucose in the serum, and therefore in maintaining the volume of water and extracellular fluid, the fluid space that surrounds the. ये भी हमने पढ़ा. Okay, दोनों से structure activity relationship को आप करेंगे. New vasopressin analogs have been synthesized with the goal of increasing the duration of action and selectivity of vasopressin receptor subtypes. Replacement with various basic amino acids, diaminobutyric acid enhances vasopressin activity. अगर उसको किसी in case के various amino acids को dibutyric जो butyric acid है diaminobutyric acid उसके साथ जब replace किया गया तो they have been seeing के उसकी activity increase हो रही है, whereas the D-enantiomers of the basic amino acids increase the selectivity for antidiuretic activity. जबकि जो enantiomers थे जब ऐड किए बनाए गए enantiomers तो वो उन्होंने basic amino acids के अगर आपने उसके enantiomers बना के जब उसकी एक्टिविटी आपने देखी तो उसमें एंटीडायरेटिक एक्शन की जो सेलेक्टिविटी थी वो इंक्रीज हुई. Deamination at position 1 increase duration of action. If अगर amine group अगर आप deamination कर दें from 1, this is the position, ठीक है? अगर यहाँ से आप amine group निकाल दें, increase करता है antidiuretic activity without increasing the vasopressor activity. The desmopressin 1 sorry तो desmopressin 1 है diamino 8-D-arginine vasopressin. It is approximately जो है 3004 greater than that of vasopressin whole. ये जो जिसमें से अमीन ग्रुप निकाला हुआ है, ठीक है? इसके अंदर से जो है desmopressin, इसके अंदर से आप जो है उन्होंने एक अमीन ग्रुप निकाला जो है उसको इसमें से स्ट्रक्चर में से जो है वो अलहदा किया है, जिसके बाद जो उसकी जो एक्टिविटी है that was around 3004 greater than that of vasopressin. Desmopressin is the preferred drug for the treatment of central diabetes insipidus. Substitution of valine for glutamine in position for further increase the antidiuretic activity. इसमें जो अभी मैंने आपको एक स्ट्रक्चर बताया था कि उसके अंदर कौन-कौन से हैं, तो अगर valine को glutamine के साथ अगर जो है वो जो है वो सब्स्टिट्यूट कर दिया जाए तो वो फर्दर इंक्रीज करती है एंटीडायरेटिक एक्टिविटी. जबकि अगर वैलरीन 4 को अगर आप एर्जिनीन के साथ कर दें या जो ये है AVP, the जो ये arginine vasopressin बनेगा after the D amino group, ये जो arginine vasopressin बनेगा has further increased, क्योंकि आप इसको किसको valine को arginine के साथ replace करेंगे, तो उस वक्त जो arginine vasopressin है has approximately 11,000 folded greater antidiuretic to pressure ratio than for that of vasopressin. 1D amino 734 dehydroproline arginine vasopressin, ये बेसिकली है यही, बट जो है ये आपको इसमें डिस्क्राइब करेंगे दिस इज arginine vasopressin, लेकिन उसकी डीअमाइनेशन किधर की गई है, एंड जो उसके दोनों एनालॉग्स हैं ये दोनों दे हैव एक्सिबिट एंटीडायरेटिक एक्टिविटी. अगर arginine vasopressin अगर वो जो है वो 734 डाइहाइड्रोप्रोलीन या 2-phenylalanine और 734 डिहाइड्रोप्रोलीन सेम जगह है, पर उसको एक जगह जो है जो एक डेरिवेटिव है उसके अंदर दे डोंट हैव दिस phenylalanine also present. So अगर phenylalanine के साथ अगर उसकी डेरिवेटाइज किया जाए arginine और phenylalanine को तो वो exhibit करता है more antidiuretic activity. Vasopressin is used to manage antidiuretic hormone deficiency. It has off-label uses and is used in the treatment of gastrointestinal bleeding, ventricular tachycardia, and ventricular defibrillation. Vasopressin is used to treat diabetes insipidus related to low levels of antidiuretic hormone. अब हम आएंगे थोड़ा सा स्टेरॉयडल हार्मोन्स की तरफ. स्टेरॉयडल हार्मोन्स बेसिकली क्या है? स्टेरॉइड्स आर, हमने ये पढ़ा था कि स्टेरॉइड्स जो है वो मोस्टली लिपोफिलिक होते हैं, ठीक है. स्टेरॉयडल हार्मोन, स्टेरॉइड्स आर लिपोफिलिक मॉलिक्यूल्स यूज्ड एज केमिकल मैसेंजर्स by organisms ranging in complexity from water moles to humans. In vertebrates, steroids acts on a wide range of tissues and influence many aspects of biology, including sexual differentiation. Steroid hormones are lipid molecules derived from a common cholesterol precursor, cholesterol. There are 4 major classes of steroid hormone: progestin, androgen, estrogen, and corticoids, which contains about 21, 19, 18, and 21 carbon respectively. Okay, steroidal hormones की अगर हम बात करें तो any of a group of hormone that belongs to the class of chemical compounds known as steroids, they are secreted by 3 steroidal glands, which are the adrenal cortex, testes, and ovaries, and during pregnancy by the placenta. All steroid hormones are derived from cholesterol. We'll start from sex hormones. लेकिन उससे पहले आप एक ये बात नोट कीजिए कि जो बेसिक स्ट्रक्चर होगा ना मोस्टली का, वो दिस इज दी जो साइक्लोपेंटानोफेनेंथ्रीन रिंग होगा ना, और ये जो 3 फ्यूज्ड रिंग्स हैं, दैट इज, ये साइक्लोपेंटानो नहीं है लेकिन इसमें जो 3 फ्यूज्ड रिंग्स हैं ना, दीज ये इसके स्ट्रक्चर में बहुत इंपॉर्टेंस रखती हैं. और जो बेसिक स्ट्रक्चर है उसका, वो जो बेसिक स्ट्रक्चर है जो हार्मोन्स का, जो स्टेरॉयडल हार्मोन्स है, वो बेसिकली कुछ 5 डेरिवेटिव्स हैं जिसको स्टेरॉयडल डेरिवेटिव जिसके बिना पे बनते हैं. नंबर 1 जो है वो है 5 अल्फा और बीटा गुनीन. ये जो होता है वो C17 का वो होता है, इसका जो स्ट्रक्चर होता है दिस इज अराउंड C17. मैं आपको जो है वो इन सबकी, इन 5 की पिक्चर्स जो है वो अलग से शेयर कर दूंगी, ठीक है. एंड नेक्स्ट इज 5 अल्फा और बीटा एस्ट्रीन. दिस इज आल्सो C17 C17 carbon atom. The next is choline, while there are 2 more, C71 or C27. C721 is a pregain and the C27 is cholesterol. Sex hormones belong to the steroidal class of compounds and are produced in the gonads, that is testes in the males, and ovaries in the female. इनको गोनाड्स बोलते हैं. Male sex hormones, number 1 is testosterone. Testosterone is a steroidal hormone from the androgen group and is found in mammals, reptiles, birds, and other vertebrates. In mammals, testosterone is secreted primarily by the testes of males and the ovaries of females, although small amounts are also secreted by adrenal glands. Biological activity, it has profound biological activity, like it has main function is the sexual function, which regulates the penis and sperm formation, stimulates prostate and genitals during puberty, influence sexual behavior, maintains sex drive and sperm count and fertility. While for the body, it helps to maintain healthy bones, stimulate muscle growth, stimulate beard, chest, and axillary hair growth, induces the male typical pattern of baldness, and influence male voice. While on mind, it helps to maintain a feeling of well-being, influences cognition skills, it decreases verbal ability, it increases the spatial orientation, mental rotation, and modulates mood and behavior. It increases aggression, and it decreases anxiety, and it decreases depression as well. While there are other factors, exogenous factors, and there are endogenous factors as well. Exogenous factors, it creates the stress, diet, weather, sexual stimuli, physical activity and sport, hormonal supplement, and contraception. These are its exogenous factors, while it has certain endogenous factors as well. Okay, we'll come straight to the structural activity relationship. Structural will first see the structural activity relationship of progesterone derivative. इसके क्लिनिकल यूज भी हैं, तो मैं आपको लेटर डिस्क्राइब करूंगी द क्लिनिकल यूज. हम पहले कर रहे हैं टेस्टोस्टेरोन. Okay. For the structural activity relationship, we'll first discuss we have different derivatives. We have different progesterone derivatives. While first we will discuss the esters of 17-alpha hydroxyprogesterone. 17-alpha hydroxyprogesterone. This is the structure of the progesterone. And 17 position पे जो है वो ये substitution हुई हुई है, so that's why we call it as 17-alpha hydroprogesterone. Since the natural hormone progesterone has a very low potency when administered orally, its ester derivatives are prepared which have good oral activity. अब आप if you note, these all are the esters, ester derivative बनाए गए ये, ठीक है, which have जो जिसकी वजह से जो ओरल उसकी एक्टिविटी थी आफ्टर टेकिंग ओरली वो इनहैंस की गई, ठीक है. अनसैचुरेशन एट पोजीशन 6 and 7. 6 and 7 पोजीशन जो है उसको 6 and 7 पोजीशन के ऊपर ये जो है इस पोजीशन पे अनसैचुरेशन इस पोजीशन पे ये 5 and 6 है ना, ये वाली पोजीशन है, इस पे अनसैचुरेशन at position 6 and 7, substitution of a methyl group or halogen atom at 6th position. 6th position के ऊपर ये 6th position है, यहाँ पे इधर जो है वो हेलोजन की भी इंट्रोडक्शन की गई. Introducing a methyl group at position 11. This is position 11. ये जो है introducing a methyl group at position 11, the above modification probably prevents metabolic reduction of 2 carbonyl groups and metabolic oxidation at position 6. The above modification probably prevents metabolic reduction of two carbonyl groups and metabolic oxidation at position 6. Substitution of a fluoro group at position 21 prevents hydroxylation at this point and enhance the oral effectiveness. इस structure के अंदर आपको ये जो है वो substitution जो है वो नजर नहीं आ रही है, इसके अंदर नहीं है, जबकि जो है ना जब ये सब्स्टिट्यूशन की गई तो जो डिफरेंसेस आए वो मैं आपको इसमें ये डिस्क्राइब कर रहे हैं, ठीक है। Substitution, inversion of the configuration at position 10 and 19 in progesterone leads to retroprogesterone, which is more active parenterally and orally than progesterone. जब inversion की गई configuration at position 10 and 19, 10 जो है position ये जो position है, this position is 10 position और 19 position जो है वो is on the chain, ठीक है। Inversion of the configuration in position 10 and 9 in progesterone leads to retroprogesterone, which is more active parenterally and orally than progesterone. Further unsaturation at position 6 and 7 gives hydrogesterone, which is orally active. This is dehydrogesterone, and at position 6 and 7, this position 6 and 7 जब इसके अंदर जो है वो further unsaturation की गई तो ये it gives an orally active compound. A progestin with a prolonged duration of action is 16 alpha 17 hydroxyprogesterone acetonide, which is devoid of androgenic and estrogenic activity when given parenterally. जब इसके अंदर मजीद जो है वो आप देखें कि इसके स्ट्रक्चर के अंदर चेंजेस लाई गई एंड जो है वो एक जो है डेरिवेटिव बनाया गया with the addition of this acetofinide. This is acetofinide structure, ठीक है, जो वो है इसको ऐड किया गया तो ये सामने आई चीज कि it is devoid of androgenic and estrogenic activities जब इसको parenteral form में दिया गया, okay। अब है C6 substituted, that is 17 alpha hydroxyprogesterone derivative. When the substitution is made on C6, further structural modification of 17A hydroxyprogesterone at 6th carbon hinders the catabolism of the compound and increase their lipid solubility, resulting in enhanced biological effect. Example इसकी है metroxyprogesterone acetate and megasterol acetate. These are the two derivatives, but it showed that it hinders the catabolism of the compound. While जब इसकी dehydrogenation की गई तो dehydrogesterone progestinational activity is further enhanced by introducing a double bond between carbon 6 and 7 in substitution 17 alpha hydroprogesterone derivative के अंदर जब जो है वो इसको double bond increase किया गया between carbon 6 and 7 तो उसकी further activity जो है वो increase हुई, enhance हुई progestinic activity, ठीक है। Now थोड़ी सी SAR of testosterone derivative. The first synthetic progestin ethistrone was prepared by इन्होंने prepare किया था in Hoffen in 1937 in an attempt to find an orally active androgen, but later proved to be effective an oral progestin. बना वो कुछ और रहे थे, बन चाहिए क्या? Ethistrone became the first orally effective progesterone. However, its oral activity is still low. And this is the structure. If you see, the main structure is same. In dimethysterone, which is modified structure of ethistrone, introduction of CH3 group in the C6 alpha and C21 position enhances progressionational activity. That is C6 यहाँ पे और C21 इधर जो है ये दो जब इसकी मिथाइल ग्रुप ऐड किए गए तो प्रोगेस्टेशनल एक्टिविटी इंक्रीज हुई. Sorry. SAR of 19 nor testosterone derivative Ethrenstein in 1994 found that the C19 methyl group is not essential for progestational activity. उसने ये देखा कि 19 पोजीशन पे जो ये this ये वाला ही जो है which इसके लिए important नहीं है, which leads to this new series of progestin, that is 19 nor testosterone nor ethyronadiol nor gestinol. ये सारे डेरिवेटिव बनाए उन्होंने. ठीक है, इसमें अगर आप देखें तो इसमें जो है उन्होंने डिफरेंट डेरिवेटिव बनाए, बट ये जो CH3 ग्रुप था 19 पोजीशन, इसको उन्होंने सब्स्टिट्यूट किया विद डिफरेंट अदर जो है ना ग्रुप्स, फंक्शनल ग्रुप्स. इंट्रोडक्शन of an alkyl group at C17 of 19 nor testosterone blocks its oxidation to inactivate compounds and increase its progestational activity. ये इसमें ये जो है आपको बता रहे हैं क्या कह रहा है वो कि इंट्रोडक्शन ऑफ एन अल्काइल ग्रुप एट C17 ऑफ, अगर C17 यहाँ पे ये जो है अगर आपको इंक्रीज कर दिया जाए तो वो ब्लॉक करता है ऑक्सीडेशन टू इनएक्टिव एक्टिवेशन कंपाउंड एंड इंक्रीज इट्स एक्टिविटी, इंक्रीज इसकी प्रोगेस्टिनिक एक्टिविटी को इंक्रीज करने के लिए इंक्रीज करता है. As in 17 alpha ethinyl analog, increasing its electron density at C17, one can simultaneously decrease its anabolic activity and promote good progestinational activity. यही जो इस एस्थेरोन है इसके अंदर क्या किया गया है कि सिर्फ जो है वो इलेक्ट्रॉन डेंसिटी को जो है वो इंक्रीज किया गया है आफ्टर एडिंग द methyl group at one point, and ethistrone is an orally effective progestin with slight androgenic activity, while removal of 19 position पे जो CH3 group है further decreases its androgenic activity, that is जो इसकी example है norethistyrone. ठीक है, following modification of 19 nortestosterone leads to even more effective progestin, that is substituting a chlorine atom at C21 position पे एक chlorine atom अगर substitute कर दी जाए, adding methyl group at C18, norgestrel example है. Unsaturation of the ring B or C अगर इनमें से किसी की unsaturation की जाए, and reduction of halogen or methyl at 6 alpha or 7 alpha position. तो मजीद एक्टिविटी को इंक्रीज किया जा सकता है. इसके अलावा एसिटाइलेशन ऑफ 17B हाइड्रोक्सी ग्रुप रिजल्ट्स इन लॉन्गर ड्यूरेशन ऑफ एक्शन, व्हाइल रिमूवल ऑफ द कीटो फंक्शन एट C3 पोजीशन पे जो है इट हैज द रिमूवल ऑफ कीटो फंक्शन एट C3 पोजीशन. अगर आप 11th उस पे सब्स्टिट्यूशन पे एनालॉग उसके देखेंगे तो उसकी एक्टिविटी क्या है. 11th जो है सब्स्टिट्यूशन, यहाँ पे जो अगर सब्स्टिट्यूशन की जाए, बल्कि 11 बीटा सब्स्टिट्यूएंट्स इंड्यूस्ड थ्रू 1,3 डाइएक्साइल इंटरेक्शन विद 18 मिथाइल ग्रुप, अगर इसको जो है वो मिथाइल ग्रुप के साथ सब्स्टिट्यूट किया जाए, यहाँ से जो ये सब्स्टिट्यूशन है इसको किया जाए तो इन अच्छा ये फिर बल्कि स्ट्रक्चर होता है. मिथाइल तो हमें वैसे ही पता है कि बल्कि स्ट्रक्चर होता है. अ चेंज इन द शेप ऑफ द स्टेरॉइड स्केलेटन लीडिंग टू बेटर बाइंडिंग टू प्रोजेस्टेरोन. और जहां भी आप बड़ा बिगर वो करते हैं तो वो सर्टेन टाइम्स या तो उसको रिसेप्टर बाइंडिंग को जो है वो रोकता है या सर्टेन टाइम्स उसकी बेटर भी होती है. तो इस यहाँ पे जब चेंज किया गया तो बेटर बाइंडिंग जो है प्रोगेस्ट्रॉन की आई एंड डिक्रीज बाइंडिंग टू सीरम प्रोटीन के साथ उसकी डिक्रीज बाइंडिंग आई. दिस एनहांसेस द पोटेंसी ऑफ द कंपाउंड. बाय कॉन्ट्रास्ट, long substituent interferes with the receptor binding and so decrease the potency. The potency 11 substituted analog was studied for their selectivity of action, and this led to the selection of D-sogesterol for further development. Okay. Androgens की I think बाद में करनी है, लेकिन ये I think पहले. Okay, we'll discuss some androgenic structure activity relationship of androgen. Androgens are regarded as derivative of androsten. Testosterone exerts its physiological activity after its conversion to dihydro testosterone. जब टेस्टोस्टेरोन exert करता है its physiological activity after its conversion to dihydroxy testosterone, that is a hydroxyl group is जो है वो डाइहाइड्रोक्सी टेस्टोस्टेरोन में जब कन्वर्ट होता है टेस्टोस्टेरोन तो उसकी एक्टिविटी इंक्रीज होती है. A steroidal skeleton is minimum structural requirement to have androgenic activity. The basic nucleus 5-alpha androsten has an androgenic activity, while ring expansion, ring contraction, and changes in configuration at C5 significantly reduces or destroy the androgenic activity. Testosterone is not effective because metabolic changes occur at 17 beta oxygen, which is important for the attachment to the receptor site, and 17 alpha alkyl groups are incorporated to prevent these metabolic changes and to render the compound orally active. Increase the length of the alkyl chain at 17 position results in reduced activity, while esterification of testosterone at C17 with a number of acid results into a long duration of action when used parenterally. A hydroxyl group at C17 alpha position at L17 alpha position does not increase or decrease androgenic anabolic activity, while several modifications at 17 alpha methyl testosterone lead to potent orally active anabolic activity. These are the two examples. Okay, जो 17 alpha position के अंदर जो भी changes किए गए. Introduction of sp2 hybrid carbon atom into the ring A renders the ring more planar, resulting in greater anabolic activity. Generally, a halogen derivative of testosterone produces compounds with decreased activity except when inserted into position 4 or 9. Okay, introduction and alpha methyl group at C2 or replacement of C2 atom by oxygen result in potent anabolic agent. Certain substitutions at 1, 2, 4, 7, and 17 result in good anabolic agent, while heterocyclic rings are also incorporated to yield good anabolic agents like in stanozolol. इसके अंदर heterocyclic ring system एक attach किया गया है. Using Birch reduction, 19 norandrogenic androgens were synthesized, some of which were found to be effective anabolic agents. The only compound with purely anabolic but minimum androgenic activity is testolectone. It is used in the treatment of breast cancer. Therapeutic application. The primary use of testosterone is in the treatment of males with too little or no natural testosterone production, also termed hypogonadism or hypoandrogenism. The This treatment is referred to as hormone replacement therapy, or alternatively and more specifically as testosterone replacement therapy or androgen replacement therapy. It is used to maintain serum testosterone level. It is in normal male range and to help with fatigue, exertion, erectile dysfunction, and loss of sexual desire in men. Used in advanced breast carcinoma of selected patients and used to relieve bone pain associated with osteoporosis and to treat certain anemias. Now, progesterone or the female sex hormone or estrogen or corpus luteum hormone we get there. Progesterone is secreted mainly by corpus luteum in the second part of the menstrual cycle. Small amounts are also secreted by the testes in male and adrenal cortex in both sex, or in large amounts are secreted by placenta. Okay. Biological activity, progesterone has various pharmacological actions with main target tissues being the uterus, breast, and brain. Progesterone in the uterus helps in the development of secretory endometrium. Progesterone is important for the maintenance of pregnancy by suppressing menstruation and decrease the uterine contractility. In the breast during pregnancy, progesterone acts in conjunction with estrogen to prepare for lactation. Progesterone supports the normal development of neurons in the brain, and that the hormone has a protective effect on damaged brain tissue. Progesterone and its neurosteroid active metabolites, pregnenolone, appears to be importantly involved in sexual desire in females. Okay, a physiological function of progesterone here, where the tissue, where from there they're released, and what they do, what they function. If when they retreat ovaries, when they release progesterone, it basically release of oocytes and facilitation of implantation and maintain of pregnancy via myometrial quickening. And it also stimulation of stromal regeneration and luteal phase of cycle. इस तरह memory gland और bone से भी होता है. We'll do a little SAR of progesterone. Okay, steroidal nucleus is essential for activity. For this, for SAR of progesterone, steroidal nucleus is important. While substitution S17 alpha with methyl ethinyl reduces its activity, while ethinodrone more active orally than progesterone. Removal of methyl at 19 is more active, while unsaturation of beta or B or C ring of 19 androstenedione derivative increases the activity, while acetylation of 17 beta hydroxy of norethinodrone long duration of action prolong the action. Therapeutic application, a significant use of progestin as of the estrogen is inhibition of ovulation. The combination of progestin with estrogen may significantly reduce the risk of endometrial cancer in women taking post-menopausal estrogen. Progesterone is used in combination with an estrogen as a component of menopausal hormone therapy for the treatment of menopausal symptoms in peri and post-menopausal women. Progestin have been used very effectively to treat primary and secondary amenorrhea, functional uterine bleeding, and related menstrual disorders caused hormonal imbalance. Progestin can be used for palliative treatment of advanced carcinoma of the breast. Progesterone is used as component of feminizing hormone therapy for transgender women in combination with estrogen and anti-androgens. A progesterone vaginal ring is available for birth control. Estrogen is a category of sex hormone responsible for the development and regulation of the female reproductive system and secondary sex characteristics. There are three major endogenous estrogens that have estrogenic hormonal activity: estrone, circulating estrogen after menopause; estriol, present in significant amount during pregnancy; and estradiol is the most potent estrogen, which is produced by the ovaries. The estrogen and to a lesser extent progesterone are largely responsible for the development of secondary sexual such as breasts, and are also involved in the thickening of the endometrial characteristics in women at puberty, in addition to the important role in menstrual cycle. The estrogen stimulate the development of lipid and other tissues, which contributes to the breast shape and function. Estrogen is responsible for growth of uterus, fallopian tubules, and vagina. Little SAR of estrogen. If we'll consider the SAR of ring A must be in aromatic for estrogenic activity, while OH group is at CH3 is also essential, while substitution at C1 reduces the activity. Smaller groups can be substituted at positions C2 and C3, that is 2-hydroxyethinyl estradiol, while SAR of ring B, presence of insertion and saturation at position 6 and C7 increases the potency of the drug. Similarly, additional double bonds between C8 and C9 position further increase the activity, while 17 alpha substituents show increased activity. While for the SAR of ring C, substitution of quadroxyl group at C6 and C7 and C11 position reduces the activity, while substitution at C11 beta position with alkyl group or alloxy group, which has 17 ethinyl group, greatly increase affinity for the estrogenic receptor compared to the estradiol. While CH2Cl group at C11 and beta configuration show more potent activity, while larger substituents, that is N-dialkyl decylamide shows antagonist activity. While for the ring D, 17 beta hydroxy is position पे जो hydroxyl group है is essential. This is 17 beta hydroxy, ये वाला जो है essential for estrogenic activity, while epimerization of 17 beta hydroxy to a alpha configuration results in the formation of less active analog. 17 alpha ethinyl or 17 alpha amynyl groups provide greatest activity due to increase in polarity. Reversal of configuration of carbon 2 or replacement of hydrogen for ethinyl and D ring leads to loss of estrogenic activity or increase in androgenic activity. The distance between C3 and C17 OH groups should be 11 to 12. Presence of this hydrophobic scaffold helps to optimize estrogenic activity. All estrogens are diethyl silibestrol. A major use of estrogen is for inhibition of ovulation in combination with progesterone. Another major use of estrogen is in hormone replacement therapy for post-menopausal women that can help to manage symptoms of menopause, used in the treatment of advanced inoperable breast cancer in men and prostate cancer. Corticoids, corticosteroids, adrenal glands located in superior part of kidney consist of two distinct parts, the medulla and the cortex. The medulla synthesizes catecholamines, while cortex synthesizes a number of steroid hormones called corticosteroids. Corticosteroids are classified into two types, that is glucocorticoids and mineralocorticoids. Glucocorticoids, these steroids regulate the carbohydrate, protein, and fat metabolism and are intimately involved in the operation process that enables the body to resist infection and stress, example, cortisol. While mineralocorticoid, these steroids mainly influence salt and water balance and the control of blood volume and blood pressure by maintaining the proper electrolyte balance. For their biological activity, glucocorticoids increase blood glucose concentration. They act on carbohydrate and protein metabolism, and promote glucagon deposition, while promote lipolysis due to the glucagon growth hormone, adrenaline, and thyroxine. While mineralocorticoid enhances the reabsorption of sodium ions from the distal tubule of kidney into the plasma and increase the urinary excretion of both potassium and hydrogen ion. Therapeutic uses, glucocorticoids therapeutically, they are used in following conditions, that is skin diseases, eye diseases, bronchial asthma, severe allergy reaction, rheumatoid arthritis, and insufficiency. While glucocorticoids may be used during the sensitive neurosurgeries, they reduce the inflammation in delicate tissues. Glucocorticoids can be used in cancer therapy to reduce some of the side effects of chemotherapy, while mineralocorticoid is used to treat adenocortical insufficiency and salt-losing androgenic syndrome. For its SAR, you need to understand these certain replacements which are done in these positions. For example, at 11B hydroxy, this is required for glucocorticoid activity. This hydroxyl group is required for glucocorticoid activity, while if we enhance the unsaturation, it will increase the activity, the glucocorticoid activity, while the 3-keto and alpha, these are the structure which, the main structure. This is essential for activity, that is gluco and mineralocorticoid activity ke liye, these both double bonds are important. While at 21 position, if we add a hydroxyl group required for mineralocorticoid activity, but not an absolute requirement for glucocorticoid activity, if we replace this with hydroxyl group. At 16 position, 16 substitution tend to decrease the mineralocorticoid activity. If we produce any substitution over here, then it decreases the mineralocorticoid activity, while at alpha 9 and 6, अगर halogen आप अगर लगा दें तो ये increase करता है activity को. Okay. Thank you very much.